وعلى آله وصحبه أجمعين. Um, mashallah, not many, but the topic is actually very much needed because the nation covered up by um, like smiling face and things, difficult to stigma around them. People don't like to be labeled as depressed or anxious or worried, but many of them actually develop psychosomatic symptoms when they have back pain or headaches or um, anxiety or disturbed sleep or disturbed appetite, and they wouldn't say they are depressed. They go unnoticed. While if you treat the depression, they actually do get better. And you could find a smiling depression in sometimes highly functioning people. Um, Depression itself could be caused by less hormones in the brain, and that could be in reaction to life events or could be internal. You don't have to have any problem to be depressed because the brain is not secreting enough hormones or the hormones are not passing from cell to cell to cell. So when you go and look into what actually could show that you are depressed, um, persistent sadness. You could be sad for one day and happy the next day, but if sadness continued for more than 2 weeks, then you need to look into why I'm really so sad. Also, loss of interest, not really interested in much. You you could have a lot of life events around you, a lot of. If they can't hear us, they can come to the back here. Is it? If the sisters can't hear us,
Sisters, you can come in over here. It's just only me. Oh, just one lady. Oh, you can still come in. I know you can. Just come in, come sit in the back. It's fine.
so so loss of interest could be one. Persistent sadness could be one. Continuously sad for more than 2 weeks. And feeling hopeless. There's nothing I can do, nothing within reach. I'm doing my best and things. People, if they notice he's depressed, oh, build yourself together, and he's not pulling himself together. He needs some real help. Um, Consistent, sometimes self-criticism. It's me. I'm not actually doing things. I'm not helping. I'm not coping. I'm not accepting. You feel guilty all the time. Or he feel emotionally numb. This is actually quite typical to depression that you depressed people don't feel happy or sad if things happen around them. Feel that you're numb and like people will be amazed why we lost the car, we lost a loved one, and you don't seem to be bothered. But his feeling, it's actually called you get thought of not wanting to live or thought of death, want to kill yourself. Well, I had one imam when I was in Wales. He was so tortured by the thought of wanting to kill himself, and how I'm supposed to be Muslim imam and leading. And he wasn't imam as graduated from a religious university, but he was studying something else in the university there. But he had information and knowledge about religion, so he was the imam, one of the imams in the mosque. But I kept seeing him to treat his depression because he couldn't cope. But one of the things with the depression, you lose interest in things, and your performer might drop, and you won't be able to cope with the pressure, especially pressure at work, and the lack of commitments dropped, and the lack of producing drops, and could be some anxiety also. But one of the things which is really important in depression, it's called anhedonia. When small things could excite you, and really nice. Oh, how you managed to cook this food, how you managed to get this dressed cheap, how he managed to get this function organized, become like, doesn't bother. People get annoyed. Oh, you don't seem to be happy with this. It's really exciting news. It's really, but he's not. He's no matter whether he's eating nice food or nice outing or nice restaurant, doesn't bother. So his sign of his depression. Physically, could be tired all the time. Could be sleeping a lot, or not sleeping enough. He loses sleep. He goes to sleep half an hour and then he wake up and he's up for 2 hours, 3 hours. He could either eat a lot or eat less. Um, Headaches and body aches and stomach ache. It's actually, when I came to Britain, it's amazing. In medical school in Syria, they didn't actually teach us a lot about mental illness. And even the students were not interested to learn. So we used to go to the and should be 15 of us, only two go, three. So you find that doctors don't know what mental illness is, so how are going to diagnose you? When I came here, oh, so and so, I saw I've been depressed. We didn't treat the depression. She had stomach ache, and she kept going from doctor to doctor to doctor. Now all the investigations doesn't seem to get better, or backache, um, or sometime overcompensating, try to cover up for your depression. You make yourself busy just to show people, no, I'm all right, and doing things has no need or no value. Or you could withdraw. You don't want to bother. Or you go. I'll be here. I'll follow you. I don't actually follow them. And sometime you could be maintaining a successful job or relationship um, or social life, but you're not happy. You're actually not enjoying it. You could break some jokes to show, no, I'm okay, I'm fine. Um, and you always, some say, oh, I'm much better than the people in Sudan, I'm better than the people in Gaza. And I'm lucky because I'm not actually in the hurricane in this country or that country. Try to comfort himself by saying, like, you should feel happy because you're not that or this. Um, but the time they get burned out emotionally and they hide the suicidal thoughts. A lady complained against me in hospital, I think a year or two before I retired. She was suicidal. I went and saw her at home, and she was depressed. And I referred the team to her, and they kept seeing her. And then I saw her in outpatient, and she was saying, all slip of the tongue, that she went with her husband to the seaside, and she decided to drown herself. So she walked into the sea, and she said, suddenly my husband appeared. What are you doing? Oh, I'm just, you know, playing with the water. So I sent the team back, and she went and complained. Oh, he was ignorant about me. Didn't he saw me 40 minutes later than my appointment? And they looked into the computer. When they come, they register arrival, and they get seen for their appointment. And but she was angry that I sent the team back again to her. She just wanted to kill herself. So uh, they hide the suicidal thought, and sometimes they've sent me a letter to me and to us, to the team, and they gave me the letter. And I went to the home and knocked on the door. Nobody answered. So I went back and talked to the. He said, "Oh, he said the patient's committed suicide 2 weeks ago." What happened? That the referral came, screened by a nurse, and didn't pick up this urgent concern. And I came to the team. There's no way. That's not acceptable at all. There's no way one nurse will screen that. And then they changed the system. Said all the referral will have to come to the team. And must be a doctor in the team, and they screen the referral and then decide who gets seen today and who gets seen in 2 weeks' time. Um, Another referral is opposite. The referral came from the GP, must be seen today. And I was seeing a patient, so I the support I was seeing was just next door to the one they referred to me. So I went from that patient across the road and came to the patient they referred to me. I was sitting, she's sitting enjoying her afternoon matinee film on Channel 4. I'm happy. So I phoned the GP. I said, look, this suicidal patient you referred to me, she's enjoying her afternoon film, so I left her to enjoy herself. There's no suicidal ideation, nothing. I just wanted to raise the concern of the doctors and the team. I ended deciding with the team that we actually better send somebody to say hello to her once every month. She's going to refer herself. I saw her twice in casualty, referred herself as being suicidal and she wants to die and things. So you have that extreme and that extreme, but we don't take anything lightly. We take it serious and prove that, yeah, we've seen her today as you requested, but we left her to enjoy her film. Um, and they usually might have sudden, unexpected crisis um, because they get so worried and raise the alarm, usually the family and things. And what to do? You need really to recognize this. I have been sad for quite a while, not eating well, not sleeping well, no interest in things which you usually enjoy, don't bother. Um, and don't dismiss your feeling. Oh, I'm fine, it's fine. You haven't eaten for days. I went to see a patient in the afternoon, and there were this toast there with jam on it and butter and jam from the morning. He didn't even eat that toast, one toast, um, and create space for rest and honesty, um, and watch for suicidal thoughts. In the Quran, um, Allah spoke about Yusuf alayhi. You wouldn't, or no one would have like a life event like Yusuf alayhi being thrown in the well and his auntie tried to accuse him of stealing, and then he went and was sold as a slave and accused of sexual harassment or attempting rape, and went to prison for no reason and stayed in prison for years and years. He didn't become depressed. So many life events, he didn't become depressed. His father, وابيضت عيناه من الحزن فهو كظيم. He was sad, affected his eyesight. He didn't become depressed. Sad. Sadness, sometime, if you are not, if you don't lose the enjoyment of life, if you are really eating, drinking, sleeping, performing, we could be sad because bereavement and things. In Islam, bereavement should be 4 months and 10 days for women and shouldn't go out of the house, and that's it. Because there is no idda in the West, there's no bereavement. You see pathological bereavement when they linger for years. That he said, اللهم لا إله إلا أنت سبحانك إني كنت من الظالمين فنجيناه من الغم وكذلك ننجي المؤمنين. That he said, praise Allah, and he begged him, he said, Allah, there's no God but you, all the praise to you, subhanaka, I was an wrongdoer. And Mazar said, we saved him from the depression, gham, the worry, depression. And you could say that in your life, and Allah will release that. Um, there's a lot of treatment for depression because it's quite common. Um, and I found in my working life, employer nasty or this, none of these. So why you say you are? So you treat the cognition, so you treat the cognitions, you look at things as it is, facts and reasons, and if you don't have hard evidence that this is going to happen to you, there's no base for becoming depressed. And we correct the behavior. You need to do a lot of things. You think you're not doing anything because you are depressed. So give them chart to say what they've done from the minute they woke up till they go to bed. Majority of them they come with a chart full of things. I said, said write full of things. I said, said write everything. You went, woke up and went to the loo and had wudu, prayed, brushed your teeth, had a shower, had breakfast, went to the job and went to the market, did some shopping, did the put the washing, emptied the dishwasher, and they will find that I've done a lot of. Oh, you're doing a lot. You're not aware of it because he's not actually acknowledging that I'm not actually bad. When he sees that yes, I'm doing really a lot, then they get better. And the other thing will try to get them to rate their emotion. Like we discuss a point, um, and then we say like I said, heart attack or losing the job or losing the wife or losing the marriage or losing the friends. And when we discuss it, before we discuss it, how sad are you? Oh, 90%. After we discuss it, how sad are you? Oh, 50%. Still sad, but reduced from 90 to 40. And we also get them this rating their emotion is very important, and they get to do it themselves. Start saying with evidence that things are not really bad, are not going to be bad, um, and combining all this cognitive approach with the emotion, dealing with the emotion, with the behavior chart and things, they get better. Usually, when I was doing this, usually it's 1 hour a week for 12 weeks. Most of my patients, I did this, lasted only 6 weeks. 6 weeks, good sessions and things. I had when I went to a training in Nottingham, they gave me a patient who was depressed, alcoholic, who was drug addict, and living with his common law wife. They have 3 children, unemployed, all the problems they had it. And we are expected to record the session, and my supervisor take the cassette and listen to it, and come next Friday and tell me. So I have to take the patient 6 months, and they should get better. And there's another registrar took a similar patient, only depressed, and after 6, 8 weeks, 10 weeks, then my patient got better, discharged, and my colleague's patient became severely suicidal and was admitted to hospital. So my supervisor said, "You are not actually using textbook methods, but your patient improved." When you come to Islamic views and how Allah in charge of things, and don't worry. And I didn't say to him Allah in charge of things. Don't think things are actually going your way because of you. It could be other factors. It could be other people. Um, it could be things out of your control, whatever. But when you get the cognitions corrected and right way, people get better. And this is they don't do it in NHS because it costs a lot. When I went, you need to write down. You see this patient, this session 1, session 2, session 3. When I started, I looked at the session 502. I've been seeing the patient for 10 years, 52 weeks in the year, and I'm not going to see that because they said you will not discharge the patient and you will not stop seeing the patient unless he is better. So you might have to come back after you finish the 6 months to carry on with that. They have a lot of drugs. Many of it have no side effects. When I started psychiatry in 1983, most drugs were horrible with a lot of side effects. But subhanAllah, Allah opened that gate for new drugs within 10 years, so many safe drugs, and you could give people, and people don't feel they are depressed and they get better without people noticing. In the past, we used to admit them to hospital, and we had to give them ECT, electric shock, and things, and treat them. Um, we need to look into what made me think of this subject, because I've seen quite a few of our brothers. They get older, they become depressed, they withdraw, they have physical illness, they stop coming to the community, things from bad to worse. They just lose social contact, social stimulation, and they have some limitation. The children mostly grown up, married with the children, have their own commitments. They leave dad and mom. I went to see a patient in Monk's Bath. Nobody opened the door. I looked from the window, and he's totally naked on the bed. And nobody in the house. The son at work, the daughter-in-law at work, and they left him. And said, no way. Either you employ somebody to look after him or we'll take him to a nursing home. But you're not able to look after dad and things. So I had to take him from their care to our care. Um, so become more socially isolated. And now we have in Soria, we have the hub and the top and the cottage and here. He must be going to that mosque, but he's not. He goes to that. He's not going there. He's not going there. He's not going there. And I can name quite a few. We lost contact with them and then died. And that's really sad because you don't want somebody to die sad. I mean, died from heart attack, died from cancer, but died because he's sad, not eating anything, not drinking anything. One of them I said, you must be sad. I said, "Oh, yeah, I'm really sad. Get your GP to give you antidepressant. And went to the GP and didn't give her antidepressant. Didn't explain enough, or the GP wasn't convinced, or whatever it is, then died. Um, my wife went to Syria and she brought a video and I said, that guy, your relative, he's sad, he's depressed. He's sitting on the balcony, he's not even looking at the. You think that he will be distracted by cars, by passing by. He wasn't asleep in the morning. So I said to them, get him this drug. And after a week, 2 weeks, and did you bring the drug? Oh, I wasn't aware of the drug. Oh, my mom gave the drug to his son. His son didn't think about it as serious. So we said to the wife, you go and get him the drug. I still have to follow up what happened. So there's a lot of treatment. There's a lot of other things like, you need to look into the care given correctly or not. Is he getting enough care or not? If he's elderly, mobility, is dressing and undressing. Because if they are not having shower a day, they might think they are smelling. If they are unable to go to the loo, they might not come to the mosque. If they can't walk properly, they will not come. There's no one. Sometime, I mean, we went to the janazah of Brother Manra, and in the central mosque, there's one elderly Muslim came with his son, and his son went down to get the shoe inside, the foot inside the shoe, because he's too old and couldn't get the shoe inside. And for the chair by the door, we opened the chair, I sit, I put on my shoes or take off my shoes, and we went to pray. I bought another 4 chairs, this chair. If you go to their houses, where the chair of your dad, they will show you. So one of them used the chair as a ongoing chair. That's not for ongoing chair. That's for me to pray. When I went to pray, the chair. So I know what I need. They will never notice because their brain is not actually geared to look at the care of elderly. Oh, you're not old, dad. Just we did upstairs. We did give a talk on the need of your elderly father or mother, and what you could do to help them. So this is missed. So the elderly stop going. He wouldn't visit mom or dad, or he wouldn't visit his children. So his social isolation worsened, and um, people don't hear about him, don't see him. they feel, what shall we do? Should we visit him or not visit him? And when you go to visit him, sometimes elderly cannot come even open the door. I went to see a lady here in Sherry, and she has a small step by the main door. I said, "What's the step for?" She said, "I can't reach the lock." So she put the step. When he opened the door, they pushed the door from outside. She fallen. So, so, so I sent the occupational therapist to look into this, and she has quite bad arthritis. She can't actually operate. So you need my mom moved all these loose rugs. And that, they said, "Oh, he fell 3 times with this." You fell and you're still using the loose rugs. So she got rid of the rugs, and she brought them these rugs, anti-sleep rugs and things. And so that stopped people going out, stopped people moving, afraid of losing control of their power, afraid of getting dizzy. One of the brothers used to come and pray with us on Friday, and he stopped. I asked his son. He said, "Oh, he get dizzy sometimes, and he's afraid of falling. He stopped coming to the mosque to Friday." What's the answer? Uh, I'm talking to my children. I'm thinking about probably in Solihull we need to get some service. You go on your way to the mosque, bring this brother. On your way to the mosque, take him back when you go back, and or when you go on visit. And they have some organization here for Get Me Lots and home, elderly care and things, and they send sometimes volunteers to visit. Um, but that's a subject which is not explored by Muslims, unfortunately. Um, but I hope you had some wake up discussion, and I'll stop here. If you want to ask me questions, I'll see if I can answer it, inshallah.
On the last point, Jazakallah where you just mentioned about elderly people in the community, how can we make made aware of them so we can maybe organize, from time to time, just to go and say hello and
Yeah,
just have a cup of tea. That would be a good idea.
yeah, this is what we need to organize to go and visit. I try to, this 60 plus club, um, to try if we can get it off the ground for they come like after Zuhr, pray Zuhr here and have some tea or coffee. We need some volunteers, obviously, to, because the elderly is not going to do the coffee and tea.
Here at Shark did that, started a few years ago. We started visiting people
Yeah,
elderly that we knew from years ago. We talked about it. Oh, let's go and visit them, see how they are.
yeah,
And
yeah.
so we started doing that.
That's very good, yes. MashaAllah, you're visiting them.
Not everybody knows those people. So
Yeah,
if you,
yeah, we
we
need
can make it aware,
people to tell us who's,
who they are, what they live.
or if his father, his mother, I work in Nottingham, I work in Coventry, I'm out of the city all the week, can you put my father on your list? And I've just seen a flyer from the Green Lane Mosque. They said they have a club for 60 plus. I said to my daughter, "Oh, they're copying me." She said, "No, probably they have been there for years, not." But that's a good gesture from the Green Lane. I'm not aware of other mosques whether they do it or not. I hope they do it.
Another symptom of depression, I guess, is people become very irritable very easily.
Yes, yeah, and anxiety and irritability.
Irritable. So,
Yeah,
because I knew an instance where somebody was, he was very elderly, he was a widower, and he was just isolated in his house. He had his family there, his son and his daughter-in-law. But they always looked after themselves and managed their own affairs and left the old man in the corner in his own room. They would take a tray of food to him and he'll eat it and then they'd take
yeah,
the tray back. And they wouldn't consult with him.
yeah.
And so whenever they engaged with him, he would lose.
Yeah, social isolation and irritability, and they feed into each other. And to avoid annoying him, they withdraw instead of looking into what make him irritable and what make him.
I said to them that this is very wrong. You should engage with him, even ask for his advice for anything. You may not heed his advice, but just ask because he is lost in a time warp when he was full of authority and he was making decisions and people were looking up to him.
Yeah,
And he
and they probably need to, yeah, they will probably need to look into whether he's depressed or not. Because if he's depressed, he will be irritable, he will be sad, he will be
Seems to be the signs.
isolating himself.
It seems to be the signs of it. But what you made a very good point because he was once upon a time on that authoritarian mind. Because he's the head of the family. You gotta have to give him that. Come on, ask him for advice. You may not like his advice, but just he will feel his
That's one of the things which feed into depression when they stop big job, especially authoritarian job. I have one patient who came to the hospital and he said, "Get me grapefruit juice." And the nurse said, "We don't have grapefruit juice." Go on, get it now. He was general manager. I was giving orders and executed. But that's not going to happen in the hospital. I wasn't trained to accept old age. One of the things which I used to meet a lot, that a lot of people refuse to accept old age and become like, suddenly uh, old they can't perform. Any other questions?
I think depression is very interesting subject. I deal with a lot of people. I have to watch out whether they're depressed or not at work.
Yeah, as employer.
I see them face to face because of the body language instead of
Yeah.
the
If you know them, you
But
know
my
that
question
that's not true.
is depression can be quite subjective,
Mm.
and I don't know about you. I mean, life is busy. We have problems. Uh, we are having change of mood depending on the day. We have a lot of pressure on us. So where is there a scientific way to determine the threshold above which you think this is depression, or below that you say this is life? We're having the problem, and we got to
Yeah,
face.
in life, what most people mistakes were, pull yourself together. Pull yourself together. You are able. No, you need to actually look into whether you have lack of. If you say somebody must have lack of insulin, that's why blood pressure go up. So you need something to compensate. You have lack of neurotransmitters, hormones in the brain. You're not secreting, your brain not secreting enough hormone. So you look sad, you lost your energy, you lost your performer. So loss of your performance, not because of old age, not because you lost your skills, but probably your brain is not secreting enough hormones. And there's a lot of tablets to increase the hormone and try to medicalize it correctly. And then you're not bad, you're not evil, you just have no hormones. If you have no insulin, doesn't mean that you're a bad person. But your pancreas is not secreting insulin. If you have no thyroxine secreted by your thyroid, you become very slow, very retarded, very slow and get thyroxine, you'll be fat. So once you point it out to the people in a gentle, mindful way, you go get better.
What you're saying is okay, but this is the treatment. What my question is, uh,
How do you
is the
diagnose it?
scientific diagnosis? Is there a
Yeah.
scientific
What I said,
psychometric test? You're saying
yeah,
one, two, three, four questions, or diagnosis to find
yeah.
out.
What at the very beginning when I said, I mean, withdrawal, lack of interest, not enjoying life. I mean, people they will answer you, "Are you really enjoying life?" You will say no. How long have you been not enjoying life? He doesn't link it to depression, but he will tell you, "Oh, I've been enjoying life for a while. When your wife cook nice food, do you really enjoy it? No, not really. When you go to cinema, you watch a film, do you enjoy it? Do you enjoy the soap opera you used to? Many people, when I came to Britain, uh, I used to sit in the TV room at 6 o'clock. I don't know when it was East End of there. Oh, they come. When it's Sunday, the Formula One suddenly they appear there. If it's football, when it's the highlight, the football highlights on BBC One, you will know the highlight is coming because my children will down from upstairs to. So have you been enjoying what you used to enjoy? You don't say are you depressed, but you ask the symptoms. Are you enjoying life? Do you feel happy in yourself? You lost interest in things you like? Do you have no energy, no motivation to do things? And you have you been like this for more than 2 weeks? Then tick 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 tick. You really need to visit the doctor and see what they
I'll
say.
ask another question.
Yeah.
Is It's very interesting over 60. Not a lot of people admit they're over 60. This is why I'm here for
We
people.
all under 60
I'm
here.
only I'm not here because I'm
Yeah.
not over 60.
Yeah.
I'm here for somebody else. Look
Yeah.
at you. Yeah, yeah.
Because I have a relative over
Yeah.
60.
So I'm 50 years. I'm 30 years. It is changing a bit. I know that. But what about depression in children? Is that something?
Who's depressed?
Yeah, I mean, we're talking about adults, but children as well. Could be.
Yeah, the worst depression you see and dangerous in women after giving birth.
No, I say children.
Children depressed, you mean? Yeah, it could be. It hit all ages. The child become isolated, unmotivated, irritable, angry very easily, lack of interest, lack of homework, doesn't do the homework, doesn't look nice, doesn't get dressed well, avoid contact with other kids, and there's many of these things. They when we teach teachers and safeguarding, this is one of the things that look for self-neglect, lack of interest, lack of motivation, drag his feet. So the other one I was saying that some women, when they become depressed after childbirth, they could kill the child. Sometimes we admit them to the mother and baby unit and I should take the child away from mom and treat mom. I saw a man, he was very depressed. That's why he said, my wife got pregnant. Oh, we're not ready to have a baby. And he was, very depressed. So it could be amazing things in all ages, but all treatable. The best treatment for younger age group is actually cognitive behavior. The older age group more likely to need medicine, treating enough. I had a patient, and so will take time. They need to take the medicine until they feel better, and then 9 months after they feel better. So it's around a year. I had a nurse who continuously complained, and I gave the patient, I said, wait for 6 months, then come to the meeting and talk. After 6 months, her daughter came and she said, I've never seen mom happy like this all my life. It's the first time she's really happy and enjoying life and enjoying whatever. And she kept enjoying life for 2 years and died. But she died of heart attack, but at least she was happy for 2 years before she died. She said, pulse will come on. So, but it takes a long time as well. Treatment takes a long time. You're not going to get antidepressant and feel happy tomorrow. Or 5 days course, no, it's antibiotic I'm talking about. But antidepressant you have to be continuously till they feel better, then 9 months after they feel better. And to feel better takes 6 to 12 weeks, so 1.5 to 3 months. Any more?
You know um, the neurotransmitter you described, I don't know, can't remember what word you used. Does that decreases as you get older? You get less and less.
Everything decreases, your brain becomes shrink, gets smaller and smaller. But not only don't secrete the hormones doesn't go from cell to cell to cell. And they become like the hormones secreting and reuptaken. So when they discovered that to stop the reuptake, the breakthrough happened in treating the depression. Um, the skills of the doctor also combining drugs because some drugs work to help each other. So you have drugs, 2 drugs or 3 drugs sometimes, and they help each other. And that mixing is really needs quite good skills. Um, but there's a lot of treatment. The younger age group, as I said earlier, probably cognitive behavior therapy will be better than drugs. Many people don't want to take drugs, and especially long-term drugs when they're young. But elderly, 70% of them will need antidepressant. It's quite a large number. When you are 70, you have 70% chance to become depressed. Because it doesn't have enough hormones, don't have enough cells. Hmm? Sorry?
Is there zero side effect for these drugs or
Most of it no side effects now. There's some have side effects. There's some shouldn't be given when people have heart problems or um, kidney problems, but there's a lot of
You're
drugs.
not addicted to
It's quite safe.
medicine.
No,
Sometimes you
not
started
antidepressant.
when
You
you
don't.
started.
If you take antidepressant, none of it is addictive. You don't become addicted to the antidepressant. You might become addicted to Valium, which is you should never take unless there's expert or supervising. And obviously, morphine derivative and drugs, codeine and things. The things that have some hard drugs in it, morphine and similar. Yeah, but antidepressant, no, you don't get addicted. But sometimes you need to take them off it slowly. Uh, but not safe, not bad. But if we develop a service like this, because
We are Muslim. We believe.
nothing to do with being Muslim or Christian or Jew,
No,
but any person, because they're more advanced in treating mental health problems and psychological difficulties and things.
So
Here,
Farhan,
less.
in your vast medical career, coming back to the topic of today's discussion, smiling depression. People in working age lives, like between the ages of 30 and 45, 50, 55 maybe, who are actively working, having day-to-day normal lives, do you think they can be depressed?
And many of them, this is more likely to be smiling depression than depression really
Okay,
withdrawal.
as
But
an
they're under
example.
pressure to perform, under pressure to go to work, under pressure to get the money to pay the mortgage and pay the car. Yeah, but they drag their feet. They are really suffering. Especially also people get depressed when they are abusing alcohol or drugs, or so there could be side effects. Sometimes could be side effects to other medical problems. But the smiling depression is more in younger age group, and
So don't you think that's more a sort of a transitionary sort of a thing? Imagine if that same person who may be dragging his feet in one job, if he gets a different job, or if he's doing something different where he gets twice the money or twice the resources to manage his affairs much better, he won't be feeling depressed as well.
no, depression not necessarily due to poverty, not necessarily due to richness. Depression comes because of his way to react to life events is not correct. You
Okay.
could see pop star with millions and things, but the way you negotiate life in your brain and how you should react to the difficulties and how to deal with it, it's twisted. And that's built in your brain and trained on it when you are a child. If he's a child and he's not trained by his mom and dad, like your children will come and shouting, screaming because of slight scratch on his finger. And I used to say to my children, "Oh dear, there's someone with this so and so he died." "Oh, I'm not going to die." So why are you worried then? So just you know, get his brain to start working. That's not going to kill me. That's not going to kill me. Yes, if you run in the street, a lot of cars around, yeah, he will die. When we were in North Wales, we lived in a close. So for my children to bike up and down the road, I put a red line, painted the red line. People might come, oh, it's a red line. Uh, Never cross the red line. When they grow older and we came here, so Dad, we crossed the red line many times. We didn't tell you, but it's in their brain not to cross the red line. Because that will kill them. So when you train the brain of the child how to cope with the life events, the difficulty, as I said, Yusuf alayhi salatu wasalam, so many life events. Prophet Muhammad sallallahu alaihi wasallam, not a single life event but hit him. He buried all his children but one alive. I have a friend who buried his son. You can't forget it. Oh, the Prophet buried seven of his children. So when he was alive, and he was often before birth, and he lost his mom, he lost his granddad, he was forced out of his country. Oh, I'm forced out of Syria. I'm in Sweden now. The Prophet lost his country. So every single disaster happened to the Prophet ﷺ, Muhammad. But he coped and he built a nation. He built a world. So, subhanAllah. Yeah.
So you mentioned a couple of events that can lead to depression, such as bereavement and death. What about what we hear commonly in this country, seasonal disorder in winter?
Seasonal affective disorder. Um, all Sweden people should be depressed because they get only 2 hours.
Almost enough.
Yeah, 2 hours day, and um, some brains they need enough locks, enough light. We ask them to sit and read newspaper or a book or whatever for 4 hours in front of a box. We give them a box with bright light to expose themselves to the bright light, and it treats it.
Does
Yeah,
that help
some.
though with bright
Yeah,
lights
yeah,
and all?
yes, it
Does
does
it
help.
like
Oh,
expose
Yeah.
these
the
last few years, I don't look forward to winter now. The dark nights and the days.
Do you have a box?
No, no, I
Locks?
guess every can get one.
Yeah, yeah. It has to be enough locks because
You can
they
borrow
rate
mine.
it. Yeah, yeah. It's enough.
It's enough.
So yes, seasonal affective disorder. Right. Okay. I think we need.